I am a general dentist, first of all. I graduated here in Costa Rica, and after that I became an oral and maxillofacial surgeon. I love what I do. I love giving people smiles and giving them some hope after having traumatic conditions in their mouth. So that's pretty much what I like to do. The relation with the patient, I would say, the relation with the patient and being able to help them out and hear them and solving the problems that they have regarding function or regarding aesthetics and regarding, giving them back the confidence. I love doing that. First of all, we all are English-speaking professionals. We all have been very well trained and are up to date regarding the national and worldwide standards that people ask, and we all are very caregiving and love people. Well, just to be honest with you, I had very good feedback from patients. That's not something I love to talk. I don't like talking about myself or bragging about anything. The idea is that patients come in and actually try them for themselves and get to meet with me and my staff and actually feeling from themselves for themselves the experience. But I do have feedbacks and very good feedbacks from patients that say that they have never been in a place where they've been treated that way, not even in the States or any places they've been to, and most of them have had many surgeries before. And actually this patient that I just saw a few minutes ago told me that he's had 11 surgeries before and he's never been treated the way he was treated here in Costa Rica by me and by the hospital professionals that helped us out. And that's very consistent with many of our patients, or I would say all the patients go smiling away from here. Not at all. Actually, I've been told by the American patients and from other foreigners that actually the technology that I use in my office and the technology that we use in the hospital, they've never seen before, in the sense that it's so good, so amazing, so new things, digital things that they haven't seen before, and everything so clean and everything so thorough, and so that's something I've been told many times before. The main concerns that our patients have when they start searching for a place to come, for the right place to come here in Costa Rica, is how they're going to be treated, their transportation, their lodging, the communication with the doctor, if all their x-rays or pictures have been seen, everything regarding that. And that's why we have a very important network of people working with us, and that's why we all the time pay attention to what their needs are, and if we need to do any conference call with the patient, any video call, any telephone call, or emails, we all the time do that in order to make our patients feel confident. And once they come here, we make sure that they're happy with the place they're staying at, they're well taken care of, they're comfortable with the transportation, and they're on time all the times for their appointments, and so we make their stay very, very warm. Normally the follow-ups, if they need to go and have a follow-up in the States, what we do is, or what I do actually, is to be in contact with the medical doctors or the other dentists back in the States. So normally what I do is I have the contact number, or the patient has my number, in order to make the contact back with the other dentist or doctor that needs any other further information, or how he's going to take care of the patient back in the States. Let's say, for example, a patient needs his stitches taken out back in the States. So I normally either do a report on the patient, and the patient takes it back home so he can actually communicate with his dentist, or we have a telephone call to that dentist. Either I call him or he calls me, in order for him to make sure, or for me to make sure, that he's gonna get the proper treatment and the proper, for example, the stitches taken out at the proper time, and what's normal and what's not. And of course, if we need to do any video conference call with the doctor and the patient to see anything that's going on, to see if it's normal, if it's something expectable or not, we can arrange that for sure. The idea is that the patient is never left alone. The patient is always taken care of. The patient is always followed up, and through emails, through videos, through photos, through x-rays, through anything, okay?